everyone. Welcome back to another episode of the Healthcare Inspired Podcast. I am your host, Jennifer McNamara. We're here on a Friday. We're so excited to start the weekend, but we have a great episode today talking about transformational leadership. And we have, of course, our amazing co-host, Maya Turner, back on the show. Welcome back, Maya.
Hello. So glad to be here.
Yes, so excited. We love talking about leadership. This is what season 3 is all about, right? Leadership, the
Yes,
connected leader. And
connected leader.
we today, ladies and gentlemen, we are connected to one of my favorite leaders in the industry, a very, very transformational leader. I'm going to bring to the stage right now our special guest, Miss Laidy Martinez. Hello, Laidy.
Hey, how's everyone doing?
We are doing great. Oh my goodness. I'm so
Yes.
excited to have you on the
I'm
show.
Air
super
hug, air
excited
hug.
to be here with you too. And then thank you for the invitation and thanks for the introduction about transformational leaders. So I'm still figuring out this role, but yes, I'm super excited.
Yes, yes. Well, I know, right? I think like we talked early on the show before, Lady and I mean, Maya and I have talked before on the show, in general about how we look at leadership. And we've always said, you don't have to be a manager to be a leader, which we know that to be true. Because honestly, Lady, I've known you for quite a while now and I've seen your career blossom, but you've always been a leader. And I just, that's why I call it transformational, because you've always been a leader, but you've transformed yourself in many ways over the
Yeah.
years. And that's what I want to talk about today. I want to
hmm
talk about your journey, Lady, because, oh my goodness. I mean, back in the day when we would have conversations, you seemed like you were just unsure, but then all of a sudden you just woke up and you just realized you had all this confidence and here you are today. So
Trailblazer.
trailblazer, yeah, exactly.
Right.
So tell us, Lady, like let's talk about Lady today. Let's shout out to your accomplishments, but tell us a little bit about how you got started in healthcare and what brought you to this place you are today.
Well, I think I just ended up taking this. I landed on the healthcare just, I think, by chance. So maybe there was just something that I needed to do because I was a delivery driver back in I think it was 2007. And then I was pregnant from with my second son. And then my partner told me at that time, you need to do something different. This is not good for you. You cannot be a delivery driver. So I was like, okay. So I look into something, and I think I always, when I used to go and do deliveries to the offices, the private practices and everything, I'll see the girls answering phones, and then I thought it was kind of cool. Like I was like, oh my god, I wish one day I end up doing that kind of job. And but I didn't like to have like the face to face with patients. I didn't really want to go and be a medical assistant. So I thought, oh, medical billing, it's always been on high demand. To be honest, it had never stopped. I think medical billing is always on high demand. So
Yeah.
I thought it was great for me. So I was like, man, this sounds kind of fun. So let's do it. And then I started like that, and then I was able to get a job after I graduated or get my certificate. So I landed on a primary care. I was there for 8 years, and I think I'm always going to be saying this. Like, I cannot thank enough to that provider who gave me that opportunity, because that's where I start building on my foundation. Like, I learned everything that I know. Pretty much 50% of the things that I know, I learned it there. So it was great that I learned authorizations, referrals, billing, coding, everything. Even scribing. I used to scribe for her too. Uh, yes.
Wow.
And then even doing like when they come in to do the surveys for the facilities, you have to do the surveys for the JCO and all that kind of stuff. I was even able to learn how to do that, contracting, credentialing, everything, you name it. I learned everything in that facility. So I cannot only thank enough to that provider that gave me the opportunity. After 8 years, I decided to go somewhere else, and then she wasn't happy. She took it very badly. She was like, because of course I was her right hand, and then she's like, oh, now what am I going to do? But I needed to do and grow. And then I think it has been such a roller coaster. Like, it's been going up and down, but you're right. At first, I think when I first talking to you guys, most like you, Jennifer, because I met you a little bit longer than Maya, but I wasn't confident with my skills. And the reason why is because back in 2021, actually, that's when I was laid off. And then and I was laid off without a reason. But little that I know, it was a blessing on disguise. And we were talking in the background about blessings and things like that. That was one of my blessings. Being laid off. Being laid off was my blessing. That was the best thing that could have happened to me because it opened the doors for me to become a production coder, be more active with coding, and really utilizing my credentials. And then now it made me to be in the place that I am right now. So I think it was the universe, or you can call it God, or some super, anything that out there, that it was preparing me to become the person that I am now. I think that's what the purpose was. I mean, losing that job was the best thing that could happen to me.
Isn't that amazing? Oh my goodness.
Yeah.
I applaud you, lady. And I am just in your corner always. But I think you're right. Sometimes we don't know what happens in our career, where it leads us. And we make a decision. And that decision, we just don't know if that's the right decision. But at the time, it seems like, oh, this is great. And then something bad happens like that. We have a freak out moment just for a minute. And then we give it time, right? And then we're like, oh wow, that was amazing. And I think we've all experienced that, right? I mean, Maya, do you have any experiences like that you've had?
Oh, yeah, and sometimes it really kind of blindsides you, right? Especially, when you're in a leader type role like you were, lady, in the office, and you're the go-to person. And then all of a sudden something changes, something in your mind changes, what, I'm not a fit here anymore. And you have to make that decision, or the decision is made for you. And then you have to decide what you're going to do next. And so I always like, lady, you are so inspirational. And it's always, what is the next? What is the next for us? What are you going to do next? And you have to keep your mind in that. So when you made that decision, after you were laid off, what was your next? And you said, you know what? I'm going to go into production coding. This is going to build who I am. So you got to make a decision to do what you believe to be the next move, and it be true to yourself. So I really applaud you, lady. You are just amazing. I want an air hug.
Yes.
No, and it was, and you're right. I'm just gonna say it really quick. It was very hard because when I find myself without a job, I started applying. Right, I was coming from being a billing manager, so I was laid off. And then I was like, okay, I have 3 credentials at that time. I already had 3 credentials, and I said, what am I going to do? I don't. Not that I didn't want to be doing billing anymore, but my thing was more like, okay, I have 3 credentials. I need to utilize them as a coder. I need to become a coder because I did not put all this time and money invested on myself just to continue doing billing. I really want to move into coding. So there were so many places that I was applying and they needed a billing or a billing supervisor or a billing manager. And I was like, no, I don't want to do it. And then it came to my it was kind of hard because some places they were not willing to pay me what I was looking for. And I was like, okay, I'm in the bottom of like, I don't want to take a money cut on my salary because I'm already used to having this type of salary that I was as a manager, right? So I was like, it was hard. It was super hard. But I say, you know what? I'm not just gonna take anything just because I don't have a job.
Yes.
I'm gonna have to take my time and then do what I really want to do, and the opportunity is gonna come. I know it's gonna come, and it came, but I didn't even have a high school diploma. And I shared this story with the two of you, I think already, that I didn't even have a high school diploma. And then when they offered me the job as a coder in the hospital, they say, well, you need the high school diploma. It's a requirement. And I said, well, I don't have it, but I do have the desire to get it. And I am already enrolled into it. I was like, why don't you give me a contingency to get this diploma in 6 months? Like, can we work with that? And they did. They did. The hospital and that like investigated say we're gonna take it because no one have asked that before, but it seems like you're so eager to be working for us, so we're gonna do it. And then they did. So I was able to get my high school diploma in 4 months instead of 6.
Yes.
Look at you. Oh, just like I just feel like that is so amazing because some people they would see that as a roadblock and they would maybe give up. But you didn't do that. And that's just who you are. You're not someone who gives up easily. Now, I know there are people out there listening or watching that probably are in a role and they're happy and they don't really have the desire to do anything else. And they see themselves in that spot till they retire. And that is completely fine. But for those of you out there that are listening and watching that want to not stay in one place, and you have that passion, you just feel antsy, right? I was there. I was in production coding too for many years for the same hospital, and I just felt I really enjoyed my coworkers. I really had a sweet gig. I had a great manager, which is hard to find sometimes, and it's really great
Yes.
spot. And I love my schedule. I was able to work flexible, home and then in the office. It was just great, but I wasn't happy within. Like I wasn't feeling like I was just
Right.
bored, I guess you could say.
Right.
I just felt like I was
Yeah.
like,
Yeah.
oh, there's more to coding than what I'm doing. And so then
Yeah.
I thought, I'm going to just test the waters, right? So I went the
Yeah.
other way. I started to work for myself. So I went out on my own and started my own company, which is different than going into a leadership role in that way. I ended up going into leadership roles as a consultant down the road. But then it becomes a necessity where you think, can I keep doing this? Is there going to be work? Is there going to be this constant like inflow of work? And this last round where I went back to work for myself after taking a break, working for another private company, I told myself, never doubt again. Never doubt yourself again, because the work just comes. And I have some amazing people in my corner, like you, Maya, and Laidy. And then, of course, I have to shout out to some really important people in my life, in my career, is Terry Fletcher, Christine Hall. Those two women have been I don't know how to really describe
Muse?
it. Yeah, I don't want to get emotional because they mean so much to me, very, very much to me. And we still talk, we text each other. They're always concerned about me, not my career necessarily either, but me personally. And that is the difference when you look at people and you see, well, they're struggling, or you want them to succeed. And they don't really, I mean, they want my career to succeed, but they also care about me personally.
Right.
And that's the difference when you have that space where you just feel like, I can do this. And you need someone to just say, you can do it, but because they believe in you, not in your career necessarily, but in you as a person. And so that really means a lot. So that's what I want to say to our leaders out there is, don't be afraid to put yourself out there, but you have people in your corner. We're here for you.
I also want to say that, especially when you talk about people in your corner, you have to have people in your corner that has a like mind like you. You can't have people that are going to place doubt when you decide to do something, and you really can't share everything with everyone, especially when you know that there is some sort of reserve about the lifestyle that you're changing. So people like you, people like Laidy, people like, Kim and Keisha and Christine and all of those people have a positive core for your success. But everyone doesn't have that. And you, as a leader, as a person who's getting ready for your next, you have to put yourself around people who are like-minded to share those types of accomplishments and goals and cheer you on as you go. I mean, Laidy, how many times have we had conversations about, what you wanted to do next? I mean, the things that you have in mind, the goals that you have for your future. And those types of people need to be in your corner, but they also need to be supportive. And if they're not supportive and they're not part of that core goal, then you're going to have some sort of ripple effect because they're going to bring you down. You don't want anyone to bring you down. You want someone to pull you up. So it's very important to have those right people around you.
Yeah, it is, and I agree with that. I think it's so important to have people that they add to you. They when you're talking to connecting with people, they adding to you. They're empowering you. They're giving you they're making you a better person, because sometimes we tend
Absolutely.
to not believe in ourselves. And this happened to me. One person that kind of, remember when I first came out, when we met in Nashville last time, Naya, we were there. One of the first, and I remember exactly what I asked you, because I was so honestly, I was speechless the way you speak when you were talking about Modifier 25. And then one thing is, at that time, I was not even speaking. I was not even, I
Yeah,
asked you,
I remember.
how did you
Oh my
get that?
gosh.
How do you get to the point? And I start speaking to different people about that kind of, how do you start developing? And one thing that you mentioned to me, as many of you know, that Spanish is my first language. I came from Mexico. So you literally told me, start speaking from what you love to do. Start speaking on your own language. You don't have to be a speaker on English. Why don't you do that? And it is true. And then I start recognizing, you know what? I don't need to change who I am. I do might have an accent. That's totally fine. I don't need to change myself. I am who I am.
Exactly.
I'm unique the way I am because I am that's me. That's Laidy Martinez. Even with my accent, even with my language barriers, even with anything. But that just makes me myself. And then I had to embrace
Yeah.
that. So it really changed my mind that, and not only that, I was talking to Pam and Christine, Pam Vanderbilt and Christine, and then Pam make us shout out to Pam.
That's
She
Pam.
make a strong, yes, she make a strong comment when she was telling me. She's like, I met you a year ago, and from the time I met you to today on Nashville, that last year, she's like, your English has improved so much. It's like it's constantly like I can see it, and then I was like, you know what, you're right. She's like, what is it that you're doing? I was like, well, I am going to school. I am trying to become better. I'm trying to practice more, even spacing myself, taking my time. Sometimes I forget because when you speak English and Spanish is super fast. So I kind of had to constantly remember myself that I need to kind of slow down so then, I can able to communicate better. Even with those little things, it reminds me that, yes, those people have helped me to improve myself because I take their feedback or critic not as it's a constructive criticism for me to become better. And I love that my friends or people that I connect, they can able to have that. And because I do strongly believe if someone gives you or spend their time telling you something, that person cares for you. That's the way I see
Yeah.
it. If I'm going to give an
Yeah.
advice to someone, I care so much about the person that I'm spending my time to let you know something so you can get better.
Yeah. Absolutely.
100%. What I
Mhm.
wanted to also talk about with you ladies is when you make a mistake. Because I think there's this thought out there that leaders are just perfect, which we know they're not. We make mistakes. And I'm talking about leadership in a management role. I'm going to switch this now to that concept because we make mistakes all the time.
Yeah.
Whenever we're trying to make decisions, and for me in my own consulting role, I make mistakes. I say things and I'm like, that doesn't sound right. And so even in a professional role, you might still make a mistake. You might say something that is not necessarily correct at the time because your brain just going so fast, right? You have so many things in there, but sometimes you misspeak, right? So how do you handle that as a leader, Laidy, when you maybe make an error, someone brings it to your attention, one of your employees? How do you stay grounded and humble as a leader and still retain the respect of your team?
I think it's important to be honest, to keep your honesty, not just to everyone, but then people can see that you're honest. Okay, you make a mistake or you maybe give the wrong information. It happened to me, and then you learn the hard way. But if you stay true to yourself and you say, "Hey, I make a mistake. Let me correct that. Here's the right information." I think that right there, you're already telling it. You know what? It's it's a human error, so it's not. I'm not gonna know it all, but being honest to it. You don't try to hide it. I think when you're true to yourself, people can see that. Then you don't need to
Right.
be excusing yourself. And I think everyone can see it when you're trying to excuse yourself, and you don't need to. Sometimes it's just you just have to accept it how it is and let it things go flow, and that's it.
Yeah. I think being transparent is key. People
Yeah.
respect you for being transparent. And you're able to correct the error. I think as leaders, um, part of growing as a leader is knowing how to correct the wrongs that you make, the wrong decisions, and being able to do it in a way that people respect you more for it and not resent you for it. And if you approach it that way, then people respect you more, and then you grow as a person because you become more personable, and people are able to come to you with those types of errors and expect for you to do the right thing when the error is approached to you.
Exactly. And
It
then
happened, and it happened to me too. I was gonna say it happened to me just recently. I mean, that I came into this supervisor role. It happened that there was an email that it was sent. It was one of our hardest specialty cardiothoracic, and then I respond to an email, sometimes you see emails coming in to you and then you respond, and I responded too quickly, and it wasn't, maybe I know I didn't give the wrong information, but I think I respond too quickly, and I should analyze. Sometimes it just take your time to analyze that information that is coming to you, so then you don't respond like right away. So it might just take time, because then you have time to research and everything. So I think that's always important too. Like, you have a busy day, and then sometimes when you're in a rush, you tend to make those errors that they aren't necessary, but you just have to kind of be more mindful about the time and how you respond and things like that. But yeah, it did happen to me. Lesson learned. We always do that.
Yeah. 100%. I mean, I did
Absolutely.
it this week too. I had a physician education, and I had learned the previous time the same thing, like that you just mentioned, answering too quickly, because I had that happen to me the last time. So when
Yeah.
I had the provider or the hospital reach out to me because the physician had a question, they wanted to clarify something, I didn't respond right away, because my inclination is I got to get this email out of my box, because my
Yeah.
OCD, I can't keep it in there. I got to get it answered. So that's my thing. It's really hard. So I'm like, no, Jennifer, wait. It's Friday.
Yeah.
They're not expecting
Yeah.
you to answer today.
Yeah.
Right.
So just give it some time, do some research, make sure you respond in a way that is professional and shows that you took the time, which I did,
Yep.
to get them the correct, valid information that they can take back to their teams, that they can trust. And that's what we do as leaders. We provide the feedback that people can trust.
Exactly.
And what you said, it takes
Absolutely.
the research, it takes the patience. Patience key, right? And
Yeah.
we're not perfect at it. We're not perfect people ever. So it's just what we know about ourselves
With
and
that.
about humanity. That's why we're human, right? That's what we consider humanity. So, and that's great. Now, talking about something that might come up, because as a leader in a management role, you might have somebody that you're responsible for and who is over you, correct? So
Correct.
you have to be able to take that feedback from your teams and relay that to maybe a higher up. But what happens if you don't agree? And this is my biggest thing I hear from managers and some of the clients I work with, is that there can be pushback because two leaders may not agree on the same concept. And it might be that they came from different backgrounds, healthcare backgrounds, or their experiences molded, right, who they were when they became in that role they're in. So they may have came from one organization, did things this way, and then you came from an organization that did things this way, and now you're in the same organization. And now it doesn't make sense, because this is the way we've always done it, and this is the way that we've always done it. So what are some of the things you want to think about when you have that pushback? What's the right way to handle that?
I think, to me, well, in this organization that I am now, luckily for me, I don't have the problem. But I've seen it before. I have seen it where I previously worked. But in this organization in particular, I don't have the problem, because I feel like the director or my manager are very supportive. And then pretty much we always, not necessarily always on the same page, but we always have this vision about listen and then see how we can come up to a common ground, right? A common, we can develop something. Let's see. That's one of the things that my director has, that she always says, I want to listen to you. I want to listen to your concerns, and then we can go from there. Sometimes we brainstorm ideas and things like that I don't really see, I didn't see it on the other organization. So which it helps, because you see the support that you're getting from your directors. It's like, I'm here to listen to your concerns. If I don't agree, that's not what I'm doing. We're gonna agree to disagree, but we're gonna come up with something that is we all in the same term. So I don't have that currently. I don't see that in my organization, but I have seen it before, where sometimes managers and supervisors do not agree, even from the same department. And I think that's something that it has to really discuss, and let's just come to a middle point, right? Where, especially if it's going to affect the team, and the two have to be, even if you don't like it, you have to come into a middle point to make sure that the workflow works perfect. I mean, at least it works for the department. because when you have those disagreements and one person says one thing and the other one says the other, it can really influence how the department environment works.
Yeah.
100%.
Yeah. It's interesting. When you come from a compliance perspective and an operations perspective, that's when you get the biggest pushback, right? And their issues is all about the money, and our issue is compliance. And so
Exactly.
you have to, especially when it comes to, when it's about making their money, you have to say, okay, well, if you're going to do this, just know our position is da
Yeah.
da 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 da. Should you choose to do that, this is what our position is. You can try that, but we're going to stand on our position. We're going to give you this information. Should you decide to do that, and if there's questions about this, what have you, then this is what we're stating, and then you could move forward. But again, we are letting you know that this is where we stand. This is why this is not right. But if you choose to do that, this is where we're giving you this information so you know. But I mean, and then typically we always get proved that we're right, and then we have to fix it on the back end. But at the end of the day, they still knew your position up front, and you didn't have to um, conform or concede. You stand your ground, and you
Yeah.
give them reason why you're standing your ground. And then once your ground is proven, they can make that decision. But you've already told them, you're transparent, and it's their decision at the end of the day.
Yep.
Yep. And that's the thing, is make it clear, not just how you feel about it, but where you're getting your information from. And I think that's what true leaders really do, is they really give you the backup. And coders do the same thing, or they should. So if a manager comes to you, let's say you're an employee or a staff member, you're not in a leadership role, but you have that leadership mindset like many of us do, you're going to do what's right because it's the right thing to do, and you're not going to violate a policy that exists, which is going to maybe affect your credential you work so hard for, or the reputation you have worked so hard for. So just because your leader a leadership role may not know what you know, share it with them. You might be surprised that how grateful they would be if you said, I ran across this information. It's going to affect our reimbursement, and I wanted to see how we're going to handle this. And it may be that you already know as a leader, you're already aware of it. You haven't had the chance to brief your team on it, because there are some out there that are just on it. They know those policy changes quick. And maybe you also have the information, you haven't shared it with them yet, but you can have that conversation and say, you know what, I'll be briefing the team on that shortly. Thank you for bringing that to my attention. Because some managers I know take that very personal when an employee comes to them and tells them something they already know, and they feel like it's an attack, but it's not. You're just wanting to make sure that you're maybe interpreting the policy right, and you want to make sure that they're aware, I read this. It's something to do with your staff thinking that they're better than you. It has to do with them just wanting to make sure that they're on the right page. And I think it's how you approach that, how you act when you get information coming at you like that. And so I want to transition into our segment, What Would You Do? Because on June 1st, or when the June reimbursement policy bulletin came out for United Healthcare, they announced that as of September 1st, 2024, under their rebundling policy for professional services, they are going to start bundling in the concept of the G2211 code that was created back into the evaluation management services. So they're no longer going to basically take the fact that this code was created by Medicare and report it separately in addition to the evaluation management services, which is a huge departure from, we just got this code, right? We just started using it, right? So your staff may come to you and freak out, be like, what are we going to do about this? And so you have to be able to respond in a way that shows your leadership, but maybe you didn't know. Maybe they saw it before you did. So how do you respond to that? What are you going to do? What's the first thing you do when you realize as a manager there's a policy that you didn't know about, and then you have to brief your team on it? What's your process?
I think it's important to communicate with the whole entire team about policies like this. I mean, in my department, it goes by department on billing, right? So billing should have had this already in their in, like I already sent it to them from United Healthcare. So I think when it's by department, I do believe that billing, coding, compliance, and everything, especially for those big organizations, right? They have to translate and convey that information across the board in all the departments, even with the providers, so they understand what policies are there, how the payers are paying, and because it is going to affect. And then, so if we're billing and they don't pay for it, is now the patient is going to be responsible for the whatever, things like that. They're supposed to be conveying, and even registration, whoever checks benefits. I do have my philosophy is that all departments need to know that information. Why? Because it could affect the patient's reimbursement, and how is it going to they might see a payment, or like a copay or co-insurance. So everyone needs to be aware of that kind of information. So I definitely have a strong relationships with my department and the billing, and I think having that relationships is important, because they're like, Kimberly always says they're like cousins. They're like kissing cousins.
I love it.
Kissing cousins.
They're kissing. I do agree with that, because if we don't have those connections in our department, then we won't be able to perform. And then remember, like, if we're in my department, we're working for the same organization.
Yeah.
Exactly.
And I also think, I mean, silos, right? When departments work in silos, it's not beneficial. And, when you think about, the what would you do in that type of instance, my mind always goes to, okay, if it's still being a service that the provider is performing, it still should be billed as what is done on the back end, maybe to adjust it off, so that it's not necessarily an additional expense to the patient, but it might be expensed to that particular insurance. Just because one payer doesn't pay, it doesn't mean you have to apply the same approach to all payers.
Exactly.
So
Yes.
yeah, so I mean, I think it's important, as a leader, to communicate that with the departments that are involved, so that there's a decision that's made and an approach that would be specific to that policy. Like most payers always, or most companies always go by CMS guidelines. Okay, we're going by CMS guidelines, but this particular payer, because it's UHC, they don't reimburse for it. Okay, so let's put a warning in there. Let's do something so it's adjusted off, so the payer doesn't have, or the patient doesn't have, any additional expense. That's where you as a leader has to communicate in between the departments, so that operations is aware, billing is aware, coding is aware. So it's not necessarily something that you shouldn't code. It's something that just needs to be adjusted off because they don't reimburse for it.
Yeah. And then maybe asking a question too, because I'm looking at the bulletin that they sent from United Healthcare, and this is a commercial line of business.
Exactly.
So now my question will be like, is this line of business, is this also applied to Medicare line of business? Because I mean, there's a lot of line of business for the different plans. So they're only talking about commercial. So now what about the Medicare Advantage plans?
Yeah.
Exactly. Exactly.
Yeah.
Those are one of the biggest things I talk to my clients about, is not only that, do you understand the different lines, the different plans your patients have and how that works, but do you understand your contracts? Because I work with a lot of plastics docs in my consulting. And so they actually have a lot of their services. They have done due diligence. And in the normal world of things, we know how certain things are cosmetic versus insurance is a common thing in the plastic surgery world. So I'm always having to go back and forth there. But some actually have contacted some of these payers. They've carved out in their contract a certain reimbursement rate or a certain concept where, even though normally that payer might follow Medicare's NCCI, they don't always have to. So they can say, in this instance, we're going to cover it this way, right? We know those payers out there that don't follow NCCI. They exist, or they have their own rules.
Oh, they have their own bundling edits. So
yes.
Yeah, And
so don't be surprised.
I feel like sometimes we get wrapped out of an NCI, and to be honest, I wish all payers would follow just NCCI edits, because it will be so much easier.
Oh my goodness!
And it would be like the best thing, but we don't live in a perfect world. So I feel like sometimes when I see those that they say, oh, they have a bundle in it. Okay, so but they're not following CMS, or they following CMS because I don't see there's no edit. So and that documentation supports it, but maybe they do have a bundle edit internally, and it's a policy for them that they created it. So that's another thing that it is very hard to keep up with their policies sometimes.
Yes. Yeah, especially during COVID, right? COVID, it
Oh,
was changing every day. I was like, oh my gosh.
Telehealth. It was like, I'm so glad that I have
yes,
experts
I
on
agree.
telehealth I can go to, because it was a bane of my existence. I worked in the surgery world. I've always worked in that world. That's where I like to stay. I don't like to go into a scenario where telehealth exists, because it stresses me out. I'm just gonna say. So I always just like, I go to my experts. What do you think about this? Because I'm gonna stay in my lane. I don't do that. I tell my clients, I don't advise on those things. I suggest that you get in contact with someone who can advise you on your telehealth policies. And I send them to someone. I don't touch that. And that's because I'm not an expert in that, and I don't want to lead them down the wrong path. I will send them the official guidance on telehealth from the resources that we have. And then I always encourage them to make a policy and make sure that your organization is following the official guidance. And if there is a rule that you would like to create for your internal teams that isn't going to violate an official rule, then you're welcome to do that. And I encourage you to make internal policies. But outside of what is written right here, our face-to-face in front of us, that's all we have. That is the information we're given. So if you feel like there's a gray area, then that's up to you to create a policy. But I'm pretty confident in Medicare. I mean, they have given such great detailed instructions on telehealth and it's evolved over the last few years. I think but right now we're in a good place. I think most of us should understand how it works because it's so transparent. But then you have policies that just pop up quarterly or in the middle of the year. And who's checking that? Like, whose responsibility is it to check that? That's the question.
Yeah. I mean, and I also think, especially with payment parities for the states and the G2211s with the commercial plans for telehealth and that type of thing. So if they bill for it, are the states going to reimburse for the G2211 the same as they do when it's a face-to-face visit? And the Centers for Connected Health policy, that is the gleaning nucleus, right? Everyone to take a look at, because states are changing, states are added all the time. And so, especially with that UHC thing, that's going to be a big deal for payment parity for UHC, depending upon the state you're in. So you got to be very clear on policy. I think the key term, Jennifer, you said it, is having an internal policy on how that's going to be handled. Are you going to not do it across the board? Is it just for telehealth? Is it just when it's payment parity for telehealth? Or are you not going to do it at all, period? So, that's that's a huge deal. And it's something that, people are going to have to make a decision about and make a policy about based upon this thing happening September 1st, or for dates of service after September 1st.
Right. And we have other things like incident too. Like, you can do it if you do it correctly, but what do people not always do it correctly? They don't know how to do it most of the time, or they think they do, and then they find out they don't. And so I was just like, just nip it in the bud,
Or like when it comes to incident too, like, we have to remember that it's a Medicare benefit. It's not like a lot of commercial payers cover. Some of them, they do have their own incident two policy, but not every payer recognize incident two, right? As Medicare
Absolutely.
does. So, and then, so that's important to also double check with, see if this mid-level, if it is going to be covered on the incident two, does the payer accept the mid-level to be seen, by the patient, or if the mid-level is contracted to with the, things, all those things that you have to kind of analyze and review to make sure that you're providing the services correctly or billing it correctly.
Absolutely.
100%,
and knowing the
your
difference.
policy.
Oh yeah. I mean, Laidy, you posted something on LinkedIn about the difference between split shared and incident two, which was right on. I was like, yes, Laidy.
Yeah.
But I mean, it's just one of those
and every time I post something, is because I'm doing it's kind of like a reaction of what I'm facing on my work. And then that day there was like 3 people that they kind of reached out to me, one of my coders, that we were like, can you explain us a little bit more with a split shirt FS modifier? So I was like, okay, so I think this is something that I can maybe, if 3/4 of mine are thinking like that, so then maybe other people are thinking it. So I'm just gonna put it out there.
Lovely.
Yeah.
That's where
That was right on.
mine come from too. Yeah. I mean, like I get my epiphanies from
It's like,
things
okay,
that
I need to
happen.
post this.
Yeah, I'm telling you what, most of my like in your face, like stop doing this, I'm gonna tell you right now, comes from Facebook. I'm telling you, ladies, some of these Facebook groups, I get the most tension in my life from the advice that people are getting from other people who aren't giving them regulatory guidance. And they're just saying, do it this way, it'll get paid. Do it this way.
You know,
and I just like, oh, stop.
You know, I always tell people I have a presentation that is about trustworthy sources in medical coding, right? So how to identify those sources, and then and I do tell people, and then I have learned, and you guys are pretty much the same way that I think, and there's so many that they think the way I think. When you ask for someone for guidance when it comes to, you know, something or maybe a case or anything like that, that person can give you, I can give you my rationale, but my rationale without a identify like a valid trust source with a authoritative source is just my it's just my point. That's it. There's nothing else. But that's the way I see it. And I think many of you might see it the same way. It's just my rationale. But my rationale with citing the source now becomes credible. Because then I'm telling you, I'm telling you this from this source. I'm pulling this information from here. It's not what I think, it's what they're saying or what's stated on the law, on the policy, all the guidelines, and from CMS, AMA, or you know, CPT, anything like that. So always give the source where you pull in that information.
Exactly.
Authoritative resources.
Yeah, unfortunately, you know, social media is, what's the word, media. And can you always trust the media? No, you cannot, especially right now. This year, we know what this year is, what it is. There's a lot of talk about, you know, what's right and what's wrong, or what policy should go in place. And, you know, I'm not a political person, but in general, people treat Facebook like they're voting for a president. Like, it's like, that is just, their opinions just fly out, and all this stuff goes out. And it's nothing that makes sense. It's just all, it's hearsay, or it's, I heard this, I saw this, but is it true? Did it really happen? Can you trust it?
No, I mean, and when you think about all of the different sort or opinions, because that's what they are, they're opinions that are out there. You have to make sure that whatever it is that is displayed on Facebook, that they have, like you say, Lady, an authoritative resource to ground their opinion. If there's no grounded authoritative resources that's related to that opinion, it could be taken any kind of way. And if their coder is gullible enough to believe that, then there's more to be said about what their sources are and what they were taught and how they were taught. So, you know, coders that are out there, you got to know that you can't take opinions from anyone without a point of reference. And the point of reference has to be a viable reference. It can't be, you know, a blog or something. It's got to be CMS or the specialty of which they are, you know, AAFP or AAP. You know, those types of people have and use Medicare resources, and they write things based upon those resources. So you can't just take any type of advice for anybody. You got to be very clear on where their opinion is coming from.
And there is, you know, defensive coding where you don't just code what's in the book. You have to be defensive about it. Is this going to get paid? Now, we're going to have to code what was documented. But coders should also be thinking about what the payer is going to think about this. Do they have a policy on this? Because before it gets to the point of billing out, you still have time to have a conversation with your physician if you are anticipating a potential issue with payment. And this is the biggest problem I have, is that those conversations don't take place. Because I'm just a coder. I'm going to code what's on the documentation. It's going to go to the biller. The biller is going to bill it out, and we'll just see what happens. And I really want to start changing people's mindset on becoming more an audit mindset. Because as we get more technology on the scene, we're going to have huge issues with compliance, inaccurate reimbursement, and we already have it now. So as these vendors come more and create these tools to automate coding, we need to be at the forefront and understand defensive coding, where we know if we were in a courtroom and someone asked us why we coded it this way, why didn't we check the payer policy? Why didn't we tell somebody that this wasn't going to pass an LCD policy for that payer? Why didn't we tell somebody? Well, we didn't. It's not my job. Not my job.
It's about education.
I think it's another thing also. You use the right word, defensive. You have to be defensive when it comes to what you're doing. Today I had a conversation with a few of my coders, and then we were talking about the E&Ms, right? And I always explained to them, and I told them, like, I want you to be confident with what you're coding, know how you code it and how it took you to that level. And right now, like, you need to know, like, if it comes back, let's say, for example, this comes back and you get audited, and you audited based maybe Medicare or even, I live in California, Medi-Cal, right? And you know, Jennifer, Medi-Cal like guidelines are very complex. So, but they follow their own thing, they have their own bundling. But I want them to know, if they code something, they're confident enough that if it comes back, they will know. They say, I'm defending this because I see this, this, and this. It has the complexity data. It has been all. It's like you can explain it and your rational supports and how you got to there. Now, someone asked me, he's like, what about when it comes to modifier 25? And I say, you need a second different diagnosis. And I said, no. The guidelines stated very clearly, you don't need to have a second diagnosis. I mean, it might help sometimes just to bypass the payer, but it doesn't really need to. And I told her, like, if there's a second diagnosis, but that diagnosis or is being addressed, it got maybe worsening, or it's being exacerbated, right there you have your reason for your modifier 25, because the condition is getting worse. So the doctor has to address, maybe it is related to the procedure, but for maybe the patient developed fever or anemia or anything, right? So they had to, before they perform the procedure, they needed to stabilize the patient or anything like that happened. And then right there you have justifying reason without having a separate diagnosis. So
exactly,
like,
it's about the work. It's the work. Yeah.
And I said, and it has to reflect the documentation. So you don't need to. You have to take the mind. There's a lot of confusion, and I think billing has that you need to have a different diagnosis to be payable. You don't have to have it. You don't.
Well, in their mind, they're trying to get it paid, right? So they're thinking, I know edits, I know how the payer's thinking, but coders are thinking about documentation. At least they should be about documentation, what's supported, because that's the world they live in. Billers live in, I got to get this paid. I got to get all this in the right order. I have to link everything appropriately because I know how the payers process things. So billers are concerned about processing. Coders are concerned about documentation and accuracy. And I think all of us are concerned about accuracy, but in the real world, we are really thinking about our lane, where we're at. And you mentioned earlier silos, right? There is one EMR out there or billing system I won't name, but it's pretty big deal. And it unfortunately puts these departments in silos. It's literally designed that way, to put departments in silos. I've worked in it and it's great, but it has queues, and your coders live in a queue. They don't see the billing, and they're intentionally kept away from it for a reason. They want them to stay in the coding world. Then they want their billers in their queue to take what they are given by a coder and process it. And unfortunately, sometimes conversations don't happen, communication doesn't happen, and you're living in a silo, and you're just doing your job, and no one's talking to each other because you've been siloed. And that's my biggest pet peeve. I'm okay with the concept of queues as long as there is communication.
I think also that there is in coding and billing, there's always a larger scale of gray than there is black and white. And because there's a larger scale of gray, rather than the black and white, those interchanging circles where that gray is, that's where the most conversation needs to be had. And if you're not having that conversation, then you're going to lose or write off more revenue than what you've built out or what the production is doing on a daily basis, because you're not having that conversation. Just like you said, there are specific payers that have specific policies. If you have a policy and that interchanging gray follows in that policy, because maybe the coding may be right, but the policy doesn't allow for reimbursement, that's still something that should be accounted for revenue, but written off, so that you know what your bottom line is, and you could separate the written off revenue versus the true revenue after the bill is paid. So you got to have some sort of balance. And if that balance isn't there, you're going to be lopsided when it comes to revenue, whether you're bringing it in or you're writing it off.
Mm-hmm.
Yeah,
exactly.
I agree.
Yeah.
Well, ladies, what a conversation we've had. And I hope that this really helps our teams know and encourages them that even if they are currently in a production environment, like all of us were at one point, there are options, and your leaders, if they really support you, will be happy to see you transition into a leadership role where you're actually into management, because they should be encouraging their teams to advance their career and making room for more people that want to also help in this way. There's room for everybody in the organizations to succeed. And I think that's important. As I get older, I start going into the next 20, 30 years of my career, I'm seeing those that are at the end of their career passing on their knowledge to me and others. And it's really encouraging to see that, we have to make room for the next generation of leaders. And that might be changing, right? The way we conduct business in 2024 is very different than the way we conducted it in 2002 when I started. So it's very, very different, guys. So staff is different.
I think it's important to keep the mindset of a change is the only thing that we for sure have a certain that we will, it's always constant. Change will be always constant. And in what we do, changes, it will happen all the time. So keep that mindset about, be adaptable. I think adaptability is important too. And then just adapt. Even if you transition to different roles, I think it's always important to be having the mindset of be adaptable.
Yes.
Exactly.
Adaptable. Exactly. Yes.
Adaptability is key. And just keep sharing what you know with others. Share everything with others, because you never know what you share with others that might change their whole world. And so don't hold things in. Don't be selfish with your knowledge. Share it with others. And let's keep building this amazing organization of healthcare that we have, this industry. And I thank you all for joining the Healthcare Inspired podcast. I want to thank our co-host, Maya Turner, and our amazing guest, Laidy Martinez.
Oh, thank
we
you.
will talk to you next time, guys. Have a good week.